with no visits, no touch, not even allowed to see others in the home. Faces became hidden behind masks and skin hungry, with no cuddles or hands to hold. Perhaps they would be paraded out behind glass like an exhibit at a reptile museum or a prisoner. For almost a year, guidance would not permit residents to leave the home or to go out for a drive in the car. After 14 months, many residents were only receiving half-hourly, socially distanced visits, and many had not left their home in over a year. They had been effectively imprisoned. Residents in care homes and their relatives suffered an unnecessarily disproportionate impact on their lives, which left them at times feeling isolated, unheard, and discriminated against. And many of these impacts are still being felt today, when the rest of society has returned to normal, and we're looking at the COVID years with hindsight. For many, these consequences have been permanent. A lack of connection can lead to social isolation and loneliness, which can have a detrimental effect on people's health and well-being. And many residents, particularly young adults, had an active life out with the care home before the pandemic, and dismantling those opportunities and routines in one fell swoop had a devastating effect. So in conclusion, it is submitted that there has been a widespread disregard for fundamental human rights and freedoms, where the most vulnerable in our society have been left isolated and discriminated against. And it's hoped that the findings and recommendations of this inquiry will ensure that this does not happen in the future.